Hi, I'm Madison. The issue I'm going to be talking about today is the controversy regarding the use of smartphones and texting in a healthcare setting containing pertinent patient information. The researchers at Pew Research Center found that as of January 10th, 2018, 95% of Americans owned a cell phone, and 77% of those cell phones were smartphones. These statistics can be broken down into gender, age range, race, your educational status, and more. But you'll see that everyone from every different category has a cell phone or smartphone. But that's just the beginning. So let's take a step back here. What is a smartphone? According to the dictionary, a smartphone is a mobile phone or cell phone that performs many of the functions that a computer has and usually has a touchscreen. This means with your smartphone in hand, you can have access to almost anything you can think of, if it's on the internet. But let's take another step back. Cell phones have been around for a while now, and our society has been taken over by this technology, and as of late, texting. Texting is composing and sending electronic messages. Since developed in 1992, texting has increased exponentially. Data collected by Jeremy Goldfarb and his associates found that in 2010, 72% of Americans were active text users. Throughout the years, we can assume that with the rise in smartphone owners goes hand in hand with increased text users. With such an increase in everyday smartphone usage and text users, it was only a matter of time until this issue was brought to such an enormous profession, such as the healthcare system. Change is inevitable, and everywhere. Back in the day, healthcare communication was mainly by pagers, telephone calls, and occasional emails. Now we have other tools, like texting, that are, according to Boole from the Library Technology Reports, robust, multifunctional, and customizable, and are leaving email and video conferencing in the dust. Goldfarb and his associates and Mueller and his associates both claimed that texting was popular, fast, convenient, inexpensive, and you could communicate with multiple people at once. I see this everywhere I look in everyday life because practically everyone has a cell phone now. Goldfarb performed a research study on texting between different general surgeon staff members. This study found that 44% of general surgeons and 47% of general surgery residents preferred texting as the primary communication method. They believed that two-way texting was superior to traditional paging and phone calls. They also said that there was an increase in communication with a decrease in disruption because according to the data, 85% believed texting was fast, 85% believed it was convenient, and 67% believed it made it easier to communicate with multiple people at once. They saw that texting between themselves and other staff members made their jobs a lot easier and flow a lot smoother. According to the data, it was found that 85% of the staff said it enhanced patient care, and 87% were comfortable texting patient-related information. Mueller performed another research study on texting, but this time it was between staff and patients. This study found that 98% of doctors have cell phones, and 73% text other staff members about work-related issues. But the focus of the study was mainly on staff members texting patients about their health care. According to Mueller, studies done related to staff members texting their patients were restricted solely to reminders about health care, such as appointments, medication, sexual health, and more. There was to be no texting about patient health care information that was pertinent and that needed immediate attention. Many patients would like to be able to receive information about their healthcare via text messages, because that's what we do now as a society. But many staff members in the study were very uncomfortable with that scenario and felt pressured to do so. There are a number of downfalls to texting, either from staff to staff or staff to patient. According to Goldfarb's research, there was a questionable problem regarding security of data transfer through texts. There was also a question about whether or not the staff receiving the text got the message, and if so, if they did anything about it. The data from Goldfarb regarding security and if they believed texting was secure said that 29% of staff either strongly agreed or mostly agreed, 46% were neutral, and 24% either strongly disagreed or mostly disagreed. In terms of the question on whether or not the receiving staff member did in fact get the text message, had no data connected to it, but was merely just a question they had. From the Mueller research study, they found that with texting, there is a breakdown in communication, which has led to 60% of medical errors that they had. The staff members also believed that there was a very big security question as well, because many texts would be sent from personal phones that are unencrypted, unsecured, and the message would remain forever. There was also an issue with the fact that many people lose their phones, so if the text messages that were sent regarding healthcare information weren't deleted, the information wasn't protected at all, and anyone would be able to see that at any time. These studies are a huge help for figuring out whether or not texting about healthcare issues or information should be allowed or not. But the studies also came with some suggestions that may help with the decision. First, if we want this to work, we need guidelines that every healthcare profession knows about, so that there's no confusion on if certain information can be said in a text message. We have HIPAA now, but some people don't know about it. They know that they can't say other things when other healthcare professionals are around, or they can't tell the family, but in terms of text messaging and information via text messaging, there's no real rule to it. There also needs to be better systems that are more secure and encrypted, so that not just anyone who picks up the cell phone can see the message. Example is we should have work cell phones that they're allowed to use, so that way they come encrypted, they can't use it for personal reasons, and it only pertains to healthcare information that only that doctor or that staff member can see. For patient safety, there needs to be consent from the patient saying that they would like to receive these messages, and that should be stored in their chart along with the information that is going to be sent. Just like any other thing that happens with the patient, there needs to be consent, because if not, no one will know that the patient said that it's all right to do that, and the staff member can get in a lot of trouble. This is just a starting point for texting and communication in the healthcare, and we will see what happens as texting becomes our very number one source of communication in the future. Thank you for listening. Also, my works cited is Boole, M, period, 2008, Changing the Way We Work, Library Technology Reports, retrieved from the Regis Library website. My second one is Demographics of Mobile Device Ownership and Adoption in the United States, with no author, 2018, retrieved from the Pew Research Center website. My third one is Goldfarb J, Kaisi A, Devin K, Rosos P, G, and Sill T.D., 2016, Smartphones and Patient Care, Exploring the Use of Text-Based Messaging for Patient-Related Communication, from the Regis Library website. My last work cited is Muller, M.D., Moyes, S.A., and Fulcher, M.L., 2016, Text Messaging Between Clinicians and Patients. Have We Got Things Under Control? Also from the library website. Thank you again. Bye.